If I can call the December meeting of the State EMS Council to order and stand for a salute to the flag. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Thank you. Could we call the roll?
Allison Burke. Stephen Cady.
Steve Cady, present.
Scott Clark.
Present.
Dr. Krupe.
Present.
Mark Devers.
Mark Devers, present.
Don Duval.
Present.
Mickey Fornes.
Mickey Fornes, present.
Carl Gandolfo. Gregory Gill. Jason Haig.
Jason Haig, present.
Teresa Hamilton.
Teresa Hamilton, present.
Don Hudson.
Hudson here.
Dr. Isaacs.
Isaacs, present.
Al Kim.
Present.
Steve Kroll.
Steve Kroll, present.
Andrew Knoll.
Andrew Knoll, present.
Jared Cutson. Alan Lewis.
Present.
William Masterton.
William Maston, present.
Mike McAvoy.
Mike McAvoy, present.
Elizabeth McGowan. Mark Philippi.
Mark Philippi, present.
Marianne Portoro.
Marion Petoro, present.
Dr. Raybridge.
Raybridge, present.
Dr. Redlener.
Redlener, present.
David Simmons. Carla Simpson.
Carla Simpson, present.
Christopher Smith.
Christopher Smith, present.
Chad Smith.
Chad Smith, present.
And David Violante.
David Violante, present.
We have quorum.
Thank you. I'm reading a script here. I, Mike McAvoy, have the privilege of calling the meeting of December State Emergency Medical Services Council. Welcome to members, participants, and observers. As a reminder, this meeting is subject to the open meeting law and is being broadcast over the internet for real. For your information, these broadcasts are available at health.ny.gov, available no later than 7 days after a meeting for a minimum of 30 days, and then a copy will be retained by the department for 4 months. Some ground rules just before you speak, please state your name and identify yourself. And in the case of public speakers, introduce yourself when you come up to a microphone. There are some forms that need to be filled out for people who are in the audience, not the vetted members of the council, and those are on the table when you first come into the room. So on our first item of business is to accept the minutes of the SEMSCO and SEMAC from September 13th of this year. Do I hear a motion?
Motion, Mark Philippi, to accept. Second, Raybridge.
Any discussion, corrections, changes to the minutes? If not, all in favor of accepting them as published, signify by raising your hand. Thank you. Any opposed, same sign. Any abstentions? Carries unanimously. Next item is correspondence. And I think I had referenced this at a previous meeting, or maybe it was referenced in training and ed. I did receive a letter from Milrems with a number of considerations regarding faculty, instructor training, and course offering. I'm going to fish out that email, put it into EDCC for the February meetings, and in the interim, follow up with the Training and Ed Committee on the items that were included there. So thank you, Mr. Philippi, for calling that to my attention. That was the only correspondence that I received.
Thank you, and on behalf of the Monroe-Livingston region, we appreciate that.
All right. Next item on the agenda is the chairman's report and the bylaws tag. The bylaws tag is continuing to meet. It has met once and looked at some templated bylaws for both SEMSCO and SEMAC that came from the state folks and are used for other councils and committees. So we're considering that. We're also looking at a red line page of the draft bylaws that we had put together with comments from DLA. So we'll continue to work on that over the next few months. I also want to just call your attention to some things that happened yesterday at the systems meeting. Brought to us on the paper with the statement that I read to you a few moments ago were some elements of the public officers law and conflict of interest that came to the council from another state council and helped that group to comply with the public officers law and the requirements therein. Some of those conflict with our current bylaws in the way that they are laid out. And I think that the fashion in which we brought that yesterday, or we received it yesterday, was well intended but poorly perceived by people who are here in the room. And I apologize to the folks who did not take that in the best of light, many of whom are here in the room today. So, you know, I think we have a systems report today. We're going to vote on some hearings. We'll talk about conflict of interest prior to that vote. And I think we'll have an amicable discussion about that. We definitely, as an organization, as a council, need to align our bylaws with the public officers law and with the practices of other councils. And that attempt was made yesterday and did not go over well with several of the council members, with many of the council members. So I apologize for that. Next item of business is the first vice chairman's report.
Great, thank you, Mr. Chairman. It's been a great year. Thank you all for the ability to serve and be a part of what's happening here. It's been a very busy year, and we'll round it out with elections at the end of today, and that's all that I have for the report at the moment, Mr. Chair, unless there's any questions for me. Thank you.
Any questions for Dave? If not, second vice chair.
Elections are still open from the floor, and we will be conducting those later with any nominations that happen to come forth from the floor.
Later, we'll do that.
What's that?
We'll do that later.
Yeah.
Okay. It's confused me. Director Greenberg, director's report.
Good afternoon, everyone. So running through our report from the Bureau. So on the operations side, we continue doing the EMS self-assessment for the agencies. So it's a new step in the process when you're doing your full service inspections. I think we have over 100 responses right now. It's been going well. If anybody would like to know some additional information on what that self-assessment is and things of that nature, please feel free to speak with Chief Ed Major. Be happy to share some of that. Some of the other feedback we've gotten with that is how can we share this information with the regions to see if there's any specific areas and things within the regions of information that we're collecting to be able to do projects and initiatives from that front. And we are going to start to look at that too as we start to collect more information and sit with them on that. On the Western region, really excited to have Tom Bonifiglio, hopefully I got that name somewhat right, is our newest district chief investigator over there. Stand up and wave for a minute. This is Tom. Very excited. Just started a couple of weeks ago, and he will be out of our Syracuse office. He's the newest district chief that will be coming out there, so he'll be working with Melissa Lockwood and the Western team on that side. In the administration front, we're working on continuing with our council documents, our PA contracts, our SEMSCO or our EMSCO contracts, and different things. Just a reminder to all of our councils, if you have initiatives or things that you have put in for, please make sure that you're submitting those invoices in so that we can pay you out appropriately and get the funds out that you need to support your functions. Also want to say a thank you to Toril, who is in our administrative group. She's been with us for a number of years now and has recently gotten a promotion, so she'll be leaving us shortly, and we wish her the best in her new job. On the education front, we have 5 pilot programs that we put out there. Each of those 5 pilot programs are out in the policy statement. We have put them out, and they came to fruition from feedback of each of you. And we have seen some uptick in them, but kind of a slow start to it. And so we would love to know more information on how we can share these pilot projects or what we can do to help you implement these projects in the given areas. This is additional funding for academy-style programs. This is the ability for an agency to pay for EMT training through an internship program. This is an intro to paramedicine program, the leadership training. We're starting to run some of those classes around the state now, as well as some new recruitment and retention funding that goes with that as well. In the education front, we're excited to see the team expanding and being able to handle more of those needs and working on, kind of speeding up some of those processes. In true transparency, again, for anybody who's wondering how long any certification or education process is taken, we have that timeline on our website now. If you go to the EMS forms page and you click on education, there's a matrix that's there. It will show you our average time for processing each of those tasks, as well as our current processing tasks. So again, just trying to get it so people understand how long things are taking to process. We have been working on some exam writing. So we've had a great session a couple of weeks ago working on our state exams. We have also been working on some of the needs of the instructors in order to help them with different projects that they're working on, advanced standing and reciprocity as well. We are working on, this is an important one, so we normally see about 3 or 4 course sponsor applications a year come into the Bureau for new course sponsorships beyond the 150 that we have. We're now averaging 3 to 4 a month coming in of people asking to become course sponsors. And we don't particularly feel there's a need for 3 or 4 new course sponsors. And so we've taken a little bit of a pause in processing them. We still will, and we will continue down that process. But we took a pause for a second to try and figure out why this uptick is there. And is there the capability to help in connecting the right course sponsors with their regional or the right kind of interest in being a course sponsor with the current course sponsors in order to meet some of those needs. We think there's a little bit of a gap there, so we paused in those applications. We're taking a look at them. Please feel free to come and talk to me after if you have any questions on this one. But I think you'll hear more about that at the February and the May meeting. We're, again, continuing to grow the education side of things. There is a job posting that is open right now. It's open until Friday for anybody who might be interested in coming to work for State EMS. We'd love to see you apply and take that interest. So this is a big one. We are really excited for this one. The education regulations are now out for public comment. They went out this morning, and I just want to say thank you to everyone on this committee, around this room, to Gina on our team for helping put this together to get it through. We're not at the finish line yet, but this is a major initiative and some of the largest revisions in regulation that we've seen in over 20 years. And so we're really excited for that, and thank you for everyone. And so what does this mean? So it's out for public comment now. We will share that link with everybody here, as well as all of our REMSCOs and PAs for them to be able to share it, with them. Public comment is that opportunity to go and to read them, to say, to write a public comment back saying, these look great, or to write a public comment of, hey, I'm concerned in this area. They'll be open for public comment for the next 60 days. At the end of the public comment period, they come back, we review all the comments. If there is no significant modifications that have to be made, then they'll move forward to this body, to the SEMSCO, for final approval and then adoption in regulation. If they do come back and they need modifications, they will go back out for public comment again. When they go back out for public comment, if they do need to go out for public comment again, they most likely will miss the May meeting. and then they will come up at the September meeting. So if you're wondering where that timeline is, that's where it is. These were originally put in as emergency regs. You heard us talk about that in September. When it went through the process, because of timelines and things like that, it was determined that they didn't need to be emergency regs, which is why they're going through that normal process now. The only difference between emergency regs and this process, emergency regs would have gone out and into effect immediately and then gone out for public comment. These go out for public comment, and then at the end of all the public comment periods, whether it be 1 or 3, they will go in front of this body for final determination. Any questions on that? This is a big thing, very exciting for us. All right, terrific. What?
I'm sorry, they can be located where on the site?
They're not on our website. I will get the link and send it out to everyone. Yep, they're on the state registry, I think it's called. So we will get it and absolutely send it to everyone. Did you have a question on education?
I was just going to say Steve Kroll could probably blast that link out on our boardable.
Yep, we can share it on Boardable. We will share it widely. And again, positive of just things are good is also welcome. So data and informatics, this is a big one for everyone too. 3.5, you've been waiting for this one. That will most likely go out by next Friday, if not sooner. And then the transition to 3.5 is up to the individual agencies. It can happen between January 1st, no later than July 1st. Just to give you an idea, it greatly reduces the number of mandatory fields, so hopefully making it easier and more reasonable for our providers to be able to chart in a more timely manner. Trauma side, things are moving forward. We are seeing an increase in the number of level 3 trauma centers from around the state, and we are working with them to become part of the trauma system, but that hopefully will make more accessibility for our EMS agencies to be able to transport trauma patients to additional, particularly more rural areas, trauma centers. EMS for children, moving forward, we have a great Vital Signs Academy OB series going on, and there's 3 more classes in that one. EMSC will also be down at the BMCC Healthcare Expo on December 17th down in Manhattan for anyone who would like to attend or see them there. The SEMSCO Pediatric Restraint Device Testing Advisory Group is working on a number of things. We get a lot of questions on this one of how do we safely transport our kids. There's some additional information coming out on that one. We just had our EMS for Children's meeting just the other day. We're very excited about that. Great meeting on Monday, actually in this room that just happened. And a number of other things, including the PEC programs happening in hospitals as well as for EMS agencies. We're north of 200 agencies right now that are PEC programs. If you're not and you think you'd like to become one, it's not a heavy lift. It's a great opportunity to really recognize, our pediatric patients and making sure that they have a safe transport when they're in our care. Vital Signs is now open. Call for Speakers is now open, and we have added a new track based on some feedback from everyone. So we will now have a Special Operations, Rescue, and Hazmat track. So if you have not spoken at the conference before and you think, this might be something of interest to you or you have subject matter expertise in speaking, please, by all means, we would love to, have you come and apply to speak at the conference on our new track. Blood regulations are in development. I think there's a tag that we're going to develop here today. I think we'll talk about that under either new or old business. I'm not sure which one. But we've seen significant movement on it, and now it's time to take that to the next step. We are moving forward on the RFP for the grant assistance for an EMS grant for up to 10 counties. We should have some more information by the February meeting, we're hoping. The OASIS grant for the training that Jenny is working on continues to teach classes. If you'd like that to come to your region, please reach out to Jenny. And our Rural Health Task Force has a meeting tomorrow. We had a great meeting on Monday night for those of you who were able to attend. If you weren't able to attend the town hall meetings, we have a second one tomorrow and a third one on Sunday, trying to reach all the different kind of when people can attend. And last, I would like to introduce Dr. Smith, who is the Chief Medical Officer of the Office of Mental Health. As many of you know, a large portion of what happens in EMS is mental health patients and transport and treatment of these patients. And we are, continuing to work more with them to help get to, solutions and opportunities to help the EMS community. So we had a presentation about crisis centers at our September meeting, and we have the opportunity for Dr. Smith to come today and just talk a little bit about his office and the work that they're doing, and to hear from you as well on what you might be looking for from them as both the governor and his office work on additional initiatives.
Hi, everybody. I'm over here. Tom Smith. Thank you, Ryan. I'm the Chief Medical Officer for the Office of Mental Health. The main reason I'm here today is to create some continuity. We had someone from the Office of Mental Health here, I think I don't know if it was the last one or the one before, and I think we should have a regular presence and provide regular updates on the work that we're doing. John Morley encouraged that and convinced me, it didn't take much convincing, that it's a good idea. So I'd like to commit to having someone from the Office of Mental Health at these meetings moving forward, maybe myself, to give updates about what we're doing, and also to hear from you, because I don't think we've ever had a good line of communication from the EMS teams or EMS world into the Office of Mental Health. As you know, there are many, many people out there with serious mental illness who don't engage well with routine community care and end up becoming very high users of acute services with frequent crises and emergency room visits and psych hospitalization stays. You all know that. I don't have to tell you about that. We've been wrestling as the state agency. As the state agency, we operate psychiatric centers and hospitals. We fund a large chunk of the community mental health treatment system with our partners Oasis on the substance use side. And we also set the regulations for mental health care, including for hospital care. So there's been a lot of great work in the past 2 years now, supported by the governor's office, to get DOH and OMH focusing more together on this population, the people with serious mental illnesses who are very high users of acute services. And we've been working more closely with DOH than we ever have been. And there's a lot more funding and support. Many of you know that Governor Hochul is a very strong proponent of improving mental health services throughout New York. And she really put up a lot of money and funding for us to do new things last year. So we have new dollars going out to hospitals to expand or create more CPEPs, the psychiatric emergency programs. We want more of those around the state if we can get them. We're expanding mobile crisis teams to go out and try to help more and be more mobile-oriented and be more crisis-oriented than they perhaps have been in the past. We're issuing new guidance and working very closely with DOH on care transitions and discharge planning standards for hospitals, emergency departments, and CPEPs. We really want to raise the bar in terms of trying to get more intensive care management, more resources to these people before they leave hospitals and emergency rooms. You know this, too often they come in and they're treated and cleared and they walk out, and then the cycle just repeats itself. So we're trying to raise the bar and create standards for care management and discharge planning, including putting out $50 million, for example, for new critical time intervention teams where we can get intensive care managers, boots on the ground, people on the street, coming to hospitals, coming to emergency rooms to connect with people and leave with them when they leave the hospital. So, and that's one of many new initiatives that we're rolling out, again, with the governor's support and in collaboration with the Department of Health. So a lot of attention and a spotlight on this issue, much more so than in the past. A very, very difficult population, I don't have to tell you that. But we really want to do something that hasn't been done and move some needles in terms of having fewer of these people on the streets, fewer of them with repeated emergency room and inpatient stays. That said, I think that perhaps one of the most interesting or important topics for you all are the crisis stabilization centers. Two of our major funding initiatives are for supportive and intensive crisis stabilization centers. So these are community-based crisis centers where people can go to. We have dollars, we pushed out dollars, or are pushing out dollars to stand up at least 12 or so supportive crisis intervention centers and another 12 or so intensive crisis stabilization centers. The intensive centers are licensed level and able to provide acute medical care, including medication management and administration. So it should be a real benefit to communities if we can get these stood up and rolled out. It's been a complex rollout. I think the RFPs were initially released about 18 months ago. We have issued, I just checked this morning, 21 awards have been issued to providers to start up these stabilization centers. I think the first one is going to open its doors in Syracuse this month. We hope another 10 of them come online in the first quarter of 2024. And then again, we want to get 24 or more of these things going across the state, crisis stabilization centers. I just realized, thinking about this coming here, we should really draft some guidelines. I'm looking over at Mark and the DOH folks. We should do this together. Some guidance and guidelines for you all. I think one of the big questions is, when and how can EMS, transport folks to these stabilization centers instead of to ERs and CPAPs? That's the whole idea. Not the whole idea that EMS is going to do it, but that's where people will go. There's all sorts of issues related to that with regs, et cetera. Right now, the simple starting point is that if someone voluntarily wants to go to a stabilization center and be transported there, they could. But I think we're recognizing that we should really draft some more clear guidance for you all, and to protect and also give clear instructions, guidance about who can go where and when. So I think we put that on our list of things to do. I'm looking at Ryan and Mark, and I'll follow up on the OMH side. But as we roll these out in the next 3 to 6 months, we should roll out more information and guidance to you all, and I'll promise that we'll do that. I'll stop with that. There's plenty more we can talk about, but this is the first time I've ever been in this meeting, so if there's any feedback or questions or things I can take back, let me know.
Mr. Chair.
Go ahead, Mr. Phillippe.
Good afternoon. Mark Phillippe, Monroe Livingston Region. Dr. Smith, thank you very much for coming and addressing us today. This is an absolutely outstanding opportunity for us to collaborate, and I truly appreciate it. My region in particular have been working closely with the pilot project at Rochester Regional, which I'm sure you're familiar with, and their efforts to get involved in intensive crisis stabilization centers as well. We do have a model for EMS transport to that center, which we hope to continue using as we go into the crisis stabilization system. So very well heard, very, very excited to see that and get involved with some collaboration.
Yeah. I forgot to mention Rochester. You've been ahead of us, ahead of this process, because the past couple of years you've been working locally and have developed those guidelines for transporting people too. So I think we're going to try to build on what you've done and see if we can scale that up across the state.
Happy to help. One of the things that has come out of some of those discussions also regionally with some of our behavioral health and substance use partners is considering alternatives to EMS transportation. So how might we get some of these folks who merely need a ride to those services but don't require emergency medical treatment to get them to those services effectively and safely. So as you start to think about alternatives and certainly innovative ways of doing this, that's something it's foremost in the mind. We've had some consortium discussions with Monroe County Department of Public Health, Dr. Aycock and her staff, and some other folks from stakeholders within the community to try and figure out ways of doing that. So I think I can speak for most of us around the room when we say that the need to transport someone to a hospital predicated around the idea of an emergency medical need is foremost in our mission statement. So we want to make sure we get folks to the right care at the right time, while making sure we're preserving resources for high acuity patients. So whatever we can do to help. Thank you.
Comment, Mr. Chairman. Dr. Smith, thank you so much for being here. My name is Al Lewis. I chair the United New York Ambulance Network, representing ambulance companies across the state. We so appreciate what you're doing. I mean, there are so many people that end up jammed up in hospitals waiting for movement someplace that may come to you instead in these crisis centers and maybe be able to be dealt differently. So it's well needed. I can't tell you how much we look forward to this. Is it possible you could share the areas that are building these out, already been approved to build these out?
Yes, we can share that.
Okay.
Not off the top of my head.
Okay, that's all
but I
right.
mean, if I got you something that Ryan could send it out to folks afterwards? An
It'd be,
update?
yeah, it'd be
Okay.
great to know the ones that are approved and underway and those that conceptually are going to be located in these areas. We'd appreciate that very much.
We'll get it to you.
Thank you very much.
I think I would even make one further suggestion of if you do have a region, or if we get that list, and if there's a good point of contact, maybe for the local REMSCO, the Regional EMS Council, to reach out to them and get an understanding of it, so that those conversations can start earlier than later. Even if, the initial part isn't to have EMS go to them, but in time it would. I think those conversations sometimes take a little bit and would be positive.
Okay.
Any other questions for Dr. Smith? Any questions for Ryan? One other item that I wanted to ask you about is the top 3 MURU queries include field pronouncement, and I understand Chief Major could tell us a little bit about the MOLST program, which has recently gotten approved and is launching.
It is. We will have the MOLST policy statement as well as the training up, I think, if not by this Friday, by next Friday. And the QR code that's up on the screen now and available, that one just brings you to training for that one. That is there. And I will just leave, and this way when Chief Major is done, I don't have to come back. Just a little bit, one other thing for everybody who's a SEMSCO member, around the table, we are working on updating some of our outreach materials, and one is the map. I don't know if you remember from a couple of years ago, we did the SEMSCO map and the program agency map and the SEMAC map. So if you get an email from us for your headshot, we are looking for that great headshot of you so that we can show everybody who's representing all the different parts of the state. We'll be working on that one. You will also see Alex, who ironically just stood up, Kaiser taking some pictures. We are going to try and get working with our public affairs group from the Department of Health to get more out about these meetings, and hopefully more will want to participate. So you see them taking some pictures and things like that, and just want everyone to have those updates as well. Chief Major.
Hi, my name's Ed Major. I'm the branch chief of the western portion of the state. Thank you, Chairman McAvoy, for giving me the opportunity to speak briefly. The MOLS training and education piece, I cannot express enough that here, this is a link to Vital Signs Academy. You have to have a login to get into. It's also on EMS Prodigy. But the team has worked for approximately 2 years to update policy statement 9910, okay, 99 goes a long way back to MOLST, but the effectiveness of this EMS training and education that Dr. Dorsett put together and a team of EMS providers across the state, to me is exceptional. So I would encourage agency leaders, EMS agency providers to really take an opportunity to not only when the policy statement comes out, go to that policy statement, review it. The new MOLST form has a lot of changes to it. It's an important component of ensuring the patient's needs and compassionate care and the expectations of the patient are met. And this training, I think, will really enhance the opportunities for EMS providers to really understand some of the scenarios that they're facing on a routine and ongoing basis related to medical orders for life-sustaining treatment. So I can't thank the EMS committee on MOLST for their efforts over the last 2 years, Dr. Dorsett, Dr. McAvoy, certainly Dr. Patricia Pamba, for their dedication and commitment to making this happen. So I think you'll find the education is exceptional, and the policy statement should be out, as Director Greenberg said, by next Friday. So thank you. If there are questions or anything, feel free to ask or pull me aside. But the team did remarkable work on that, and there's continuing efforts to develop things further. But thank you.
Thanks. Any questions for Chief Major? If not, we'll move to Dr. Doy now.
Okay, thank you, Mike. First, I want to apologize for the fact that CEMAC and Med Standards was canceled. It was unknown to myself and the department that we would not have a quorum up until 2 days ago. And Ryan and his team did an excellent job trying to get people to come. The members who didn't come had legitimate reasons why they couldn't make it here. Just so folks know, CEMAC is made up of 21 physicians that are voting members. Of those 21, one is a trauma surgeon, one is a pediatrician, which is Dr. Cooper, and one is a psychiatrist, which to this point we have not filled, although we do have somebody who's interested. The trauma surgeon unfortunately made one meeting and hasn't come since, so obviously that person's being replaced. We have a number of people being vetted for positions, but that has not come through, which has caused a problem with getting enough members to actually come. We need a majority of those 21 to come to make a quorum, and alternates cannot vote, so the alternates don't help us at all. So what are we going to do in the future to try and avoid this? Well, obviously, we want to get people vetted, replace the trauma surgeon, hopefully get the psychiatrist to come on board. I'm going to start pre-meetings before CEMAC, and 3 to 4 weeks beforehand to get people committed to coming to the meetings, so we know that we do have a quorum. And there'll be probably the potential, if you did not come, the loss of your seat if you have an attendance problem. Looking at previous attendance, other than our trauma surgeon, no one has been specifically egregious in not coming to meetings. Again, I apologize that we didn't have it. And I'm happy to answer any questions anyone may have.
All right, so you will send a veiled threat to the committee members?
There was a couple of questions just on what will happen with protocols that were supposed to be at Med Standards and at CEMAC. It sounds like that will just move to the February meeting?
They'll end up moving to the February meeting. Hopefully we'll not delay it because they were not going to come into effect until July. So just
So you
delays
think
it.
that timeline would
We
stay
should
the
have enough
same, but would be
Just
voted
delayed.
on and discussed?
In February. Yes.
Great.
All right. Committee reports. So the first is executive. We had about almost 2-hour-long executive committee meeting this morning. One of the things that we noted is that the vast majority of work for this group happens between meetings, and you see most of the committees and the work groups meeting on Boardable. And so really, we're not coming here to SEMSCO and SEMAC to do our work. We're coming here to meet with each other, collude with each other, and get some of the things done and passed that are being worked on by the committees between their meetings. And I think that's a much more effective use of everyone's time. The other committee is Med Standards, and Dr. Marshall has reached the end of his term as the member of SEMSCO who would chair Med Standards, and so Dr. Raybridge has taken over as the chair of Med Standards, which we believe is one of the reasons why no one showed. So congratulations on that.
Thanks. It was a very easy meeting to run. I appreciate it.
So moving along, Don Hudson, you want to do training and education?
Yes, thank you, Mr. Chairman. So training and education met. We had a more than full agenda, but we focused on 2 principal priorities due to time constraints and otherwise. The first, just more informational than anything else. So in parallel with the National Registry ending their practical skills exam for paramedic originals and what impact that not only has on state paramedic originals, but also then the trickle-down effect to paramedic refreshers, and quite honestly, all of our levels of practical skills exam for both originals and refresher classes. A working group was formed to look at that and come back with recommendations to training and education, which would then more than likely appear in front of this committee for forwarding and approval to the Bureau and Commissioner. So look for that come February, as we'd like to stay ahead of that, so we're on board with a plan before we find ourselves with our back against the wall. We do have a seconded motion coming forth, so I think we'll get that up on the screen so we can read it, so everyone can see it. So while that's being called up, this is specific to the continuing planning for the sunset of the EMT critical care level of care within New York State. Just some history. So a number of years ago, the Bureau and core sponsors and quite honestly people from all over the state got together to come up with a sunsetting plan that was then implemented. Contrary to popular belief and any evidence that we can find, there was no actual date where that would then finally sunset. So the Training and Education Committee, in conjunction with Med Standards, Medical Direction, and core sponsors, and again, a well-rounded collaborative effort to this point, came up with these recommendations, which could be looked at as provocative, as they are somewhat intended to be, so that we can put forth some proposed dates to really drill down on this and have a very public and open conversation about what the reality for those dates should be. So I'll read those, and we have a motion to SEMSCO. I guess it's easy to read off my tablet. Commensurate with the acknowledged concerns regarding curriculum, scope of practice, and comparable national standards, while also allowing providers, agencies, and regions to prepare, the sunset of the the New York State EMTCC should follow this process and timeframe. All expired EMTCC can continue to refresh at the AEMT level via established processes indefinitely. Bullet 2. The final EMTCC to paramedic bridge shall commence in April 2026, thus to coincide with the below. Bullet 3. The ALS collaborative protocols will remove the EMTCC level of care when implemented on the annual revision timeline, 0000 hours on July 1st, 2027. All currently certified New York State EMTCC shall expire at 0000 hours on July 1st, 2027, and be automatically recertified at that time at the level of AEMT for the duration of their current cycle. All EPCR platforms in use in New York State shall reflect each previously certified EMTCC by their new level at 0000 hours on July 1st, 2027. So that passed and comes before SEMSCO as a seconded motion.
This had lively discussion at Training and Ed. I think out of respect for the physicians at Med Standards and SEMAC, I would like to move to remand this back to Training Ed, Med Standards, and SEMAC, as well as solicit public input between now and the February meeting.
So as Chair of Training and Ed, I would support that. Again, this is not something we need to rush to. It's something that is proper in mine and others' opinions, hence it comes before you from the committee. But again, we need to get this right. And in order to do so, we need every voice and every set of eyes on it. Unless somebody here sees differently, I would be fully supportive of that.
Any discussion on a motion to remand this? If not,
That would need a separate motion, right, or a motion to table? Table or remand?
yeah, we're not tabling, we're remanding it.
Then that's the motion.
Yes.
We'll remand it back to Training and Ed and Medical Standards for further discussion.
And to open for public comment.
Yes, and open for public comment. Thank you.
And Don Hudson, I would second that.
Any other discussion on that? If not, All in favor of a motion to remand this, signify by raising your hand. Anyone opposed, same sign. Anyone abstaining? All right, carries unanimously, so that's remanded back to training and ed, to med standards, so Dr. Raybridge now has something to do, and to Dr. Doyna.
So, go ahead, Ryan.
I just want to talk on the PSE for 1 second, if you don't mind, in the first topic that you brought up. So just clarity on the PSE. I know we get a lot of questions on this one. So currently, right now, based on the current regs, regardless of what National Registry does, we will still have to have a PSE, the traditional PSE that we see today. And that will continue until such time as training and ed, as well as the department, determine that there's a different process, which can only really happen with the new regs. So until the new regs are published and actually go into effect, we won't really be able to look at, I think we'll be able to look at, but we won't be able to determine what that would look like. So we are moving towards that, but I just want to, again, make everybody aware. Realistically, actually, they will not be approved before the May meeting and possibly as far as the September meeting. So for those who are running programs and wondering, will there be a PSE, will there not? I don't know, Don, if you feel the same, but I would say through 2024, for the most part, there will be PSEs the same way they are today. If it happens to go faster, then great. But otherwise, I would plan the same way we've been doing it for many, many years, and then more information to come, because I would imagine that Don and his team in Training Ed would also give a grace period or an implementation period for whatever it is in what that new model will look like as well.
Yeah, I think that's entirely fair, and thank you for clarifying that. So, yeah, just to reiterate, business as usual until you hear differently. But we wanted to continue this conversation as we hopefully getting better at being ahead of things rather than finding us at midnight, like, how did this sneak up on us? So I'm not saying we're good at that, but I hope we're getting better at it. Just lastly, then, to the public comment for the EMTCC, in my mind at least, I think we've seen some pretty good successes utilizing the state forms page and the Drupal. Unless somebody has a better idea, I would propose that we post these, what we just sent back, the 4 bullet points, asking essentially, are you in support of or against each one individually, so that we can collect some data that we can crunch and drill down on each individually. And of course, leave a comments box where people can send in death threats or whatever they have in mind. So,
again, all of our surveys are up on the EMS forms page, drop down provider feedback. We will make all of our REMSCOs and program agencies aware at the point that we release the survey questions that Training and Ed requests in order to get that feedback. And the sooner the better, and the, really looking for all the feedback. So keep that in mind.
Mr. Duval?
Not to put the administrator, designer, Muru on the spot, but my understanding from a little bit of a conversation last night was that they have the ability within the app to look at provider levels who are actually using the app. And I believe there's an opportunity there to pull some good data from the protocol app with regard to the amount of CCs that are actively practicing with a platform that's directly in their hand and not a survey that they need to go look for on the website. Just a thought.
And we have that data, which was sent out with the SEMSCO notes of the 19,000 providers. There are 2.7% that are EMTCCs using the app.
So just to that, of course, I want to use every mechanism at our disposal, and I, more importantly, want to be mindful of any blind spots. So I only say that to my own knowledge within my own region. Not everyone's using just the app, the same way not everyone will answer an online survey. So I don't think there's any downside in, sort of using a shotgun approach to hit the target here. Let's put it out every way, shape, and form and get the answers we're looking for.
You got a couple other items on your agenda. Do you want to comment at all about the instructor certification, recertification, and the other work groups that you have?
Yes, so just briefly, so the instructor certification, that was initially tasked with not only looking at the current New York State policy for CLI, CIC, instructor certification, recertification, but also in concert with the agenda for the future, white paper for recruitment and retention of, in this case, instructors, looking at reciprocity to our partner organizations or partner professions, whether it be within medicine or outside of medicine. So the example would be, if you're a New York State certified higher education teacher, can you then become a New York State CIC to teach EMS classes, and what should that process look like? So we've made some great strides towards that. We have a fairly robust and good working document that we will put forth at some point in the near future, but that's what that looks like. Similarly, critical care interfacility transport, looking at parallel and community paramedicine certifications, these micro-credentialing as they've become to know, what should that look like? Similarly, field training officers, should there be a state-level certification for field training officer, and if so, what should that process be? If not, should the state put out at least a best practices document saying these are the courses or the curriculums you should be looking at in order to do this? And again, the hope is that we're not going to see everything or know everything, and somebody's going to come back to us with an even better idea. So we do have a bunch of those open items that will be coming before this body at some point in the near future, but not today.
Okay, thank you. Any questions for training and ed?
Mr. Chair, just a question on that seconded motion that came forward. Does that have to be defeated for us to move on, or was that deferral to the other two committees good enough?
A motion to table or remand is in order at any time,
Okay.
and it does that with that motion.
Okay, just wanted to make sure.
Finance, Mr. Kroll.
Good afternoon. We've got two motions to work on today. I'm just going to start passing some handouts to my left and right, if anyone wants to grab them, and grab one. First one has to do with the workforce survey that we completed and reviewed some of the results of at the last meeting. I think many of you may remember We Are the Emergency Medical Responders workforce survey we did in 2019 that was published. It still lives on the University of Buffalo website for those that want to find it, and some others places, but we've long wanted to update this information, which was very helpful in showing the shortages that we're having and some of the reasons behind the shortages of EMS personnel. Over the last couple weeks, we have taken data from 4 sources and put together what is now going to be Where the Emergency Responders Update on the Workforce Shortage 2023. And you'll see the executive summary of that coming around. It's been worked on by the Finance Committee. And we have a seconded motion that Teresa can bring up while I'm chatting to move this forward. Our goal is to take this information, which combines information from the 2019 report, then adds information from the 2023 salary survey, data from the Bureau of EMS's presentations to the Public Health Planning Council's Policy Committee, some federal information from the National Association of EMTs workforce survey, and some Bureau of Labor Statistics data. And if you look at the draft, you'll see all the sources are cited in green. So the seconded motion is resolved that SEMSCO endorses Where the Emergency Responders Update on the Workforce Shortage 2023 and requests that the Bureau of EMS staff provide formatting and production assistance to the Finance Subcommittee for completion of a public presentation for release in early 2024. So our goal is to produce basically another version of this with a glossy look with some charts and graphs that go along with this data so that we have another tool to share with policymakers and share with public that shows the continued challenges we face in the workforce. I don't think we're going to go through at this meeting the bullet points again, since we went through them at the last meeting. What I do want to reiterate is that there is regional drill down on the 2023 data. That data is held by the Bureau of EMS. If any one of the program agencies would like to have the data for their region to see how their region fell out in the survey, that could be made as a request to the Bureau of EMS, and they will get that data to you. I think any regional representative on the SEMSCO can request that as well. And so you can look at local strategies, not only the state strategies. I don't think anyone here will be surprised with the summary, is that the situation that we thought was going to occur in 2019 and we projected would occur has begun playing out. We had a pandemic between that, but a substantial number of our EMS providers are planning to exit our field or don't feel that our field is a place where they wish to finish their careers. So some of the numbers are startling, with a good third of EMS providers feeling that they don't have a future in EMS, a good third of EMS providers saying that they feel they're only in the field for another 5 years, and with a acknowledgement that the number of certified and working EMS providers having dropped by 17.5% over a 3-year period, putting us at what is probably a low for my career in the total number of certified and working EMS providers in the state. So we hope that this data, while sobering, becomes a tool for all of us to use in our continued work. And we did have a good discussion of it at the committee meeting yesterday. A couple suggestions for new pieces of data were made. 2 of the 3 of them have already been plugged in. One more, I'm just waiting for the numbers to come back. The Bureau has the data, they just haven't been able to get the number for us while we're here. Those are not material changes, they're just a couple clarifying pieces of information. So I'd like to open it up for discussion, and at the end of the discussion, would love the SEMSCO's endorsement of this product to be moved forward into final production. And the next time it will come before this body is when you get to see whether it be a print version or a electronic version, a well-produced and nice version that we can all use, and hopefully we'll have it early in 2024.
Any questions regarding this? Do you want to vote on this motion?
Yeah.
So you're making the motion?
Well, the motion is made, so it's a seconded motion.
It's a seconded motion.
Yeah.
All right.
So whenever you're ready to vote, we vote.
Any discussion on the motion? If not, I will entertain all those in favor raising your hand. Any opposed? The same sign. Any abstentions? Well, this is a very unanimous group. So that carries.
Thank you. This has been it's been, since we finished that in 2019, we've been trying to figure out what the next step would be. So this will be the conclusion of 4 years of thinking about how to take the next step, and I'm pretty excited about that. All right, so we have one more seconded motion that is coming from the Finance Committee, and that has to do with the budget. And so while it's up, I'll give a little bit of background. Over this past year, the Finance Committee has been working with various parties, especially the program agency leaders, to talk about what budget request we would make for the state fiscal year 2024-25 budget in the areas of training and education, EMS program agencies, and regional councils. You'll see on the screen, and I'll read when we go through the motion, the recommendations that we wish to have SEMSCO endorse today and move forward. In addition to moving forward those number recommendations, we are also asking to move forward the narrative that goes with them. And what we did this year, which is a little bit different than what has been done in past years, is not only are we recommending funding levels, but we are recommending programmatic innovations and changes in how that money is spent. So when you read the document, it talks about not only what we want to spend on education, but innovative ideas in education that will help us to spend that money. The Bureau staff has been collaborating with us on this. The program agencies has been collaborating, as well as the members. This is really the education committees work closely with us, and the finance committee. In addition, with regard to the program agencies, again, not only are we asking for the program agency budget, but the program agencies worked with us in writing the narrative of why they are deserving of more funding, what new deliverables they have been working on that may not have been there 10, 15, or 20 years ago, to demonstrate the need that they have for increased funding. The funding levels are training and education reimbursement, $7.1 million, EMS program agencies, $4.3 million, regional councils, $500,000, for a total of $11.9 million. We're requesting a 5% increase in training and education, a 11% increase in regional councils, and a 28% increase in EMS program agencies. This has been the subject of a lot of discussion between the Bureau of EMS and budget officials at the state. Since our last meeting in September, the governor did make a public statement that she was asking all state agencies to bring a zero-sum budget forward, being that looking at the fiscal circumstances, tax revenue, state's expenses, there's going to be a deficit, so the governor had said, let's bring forward asked her agencies to bring forward basically flat funding. We had a much more aspirational set of numbers asking for much higher increases, and when we had some of these discussions with the Bureau and with state officials, I'd like to first say I'm very encouraged because they looked at our draft and they paid a lot of attention to what was in our draft. And I think that shows that the governor, the budget department, and Department of Health understands the serious situation that EMS is in, the things that we've been talking about at this meetings, and it merits more attention than just saying, well, we'll just, we gave them this much last year, we'll give them the same this year, and essentially a lot of our programs have been flat funded for a long time. Serious discussion over what reasonable levels of increase for us to request are. Now, that doesn't mean if we forward this recommendation, that's what's going into the governor's budget. It goes through many levels of review inside first the Department of Health, then the Division of Budget, then finally with the governor's staff on what they put together as a whole budget. But we think this is a reasonable request. The biggest piece being for the EMS program agencies who have been flat funded for 2 decades. I have a side comment to make on the training and education reimbursement, and that is we had a long discussion about this at our committee meetings yesterday, that it is incumbent on us, and when I say us, I mean the bigger us, not those of us in this room, but our profession, to master the recruitment and retention strategies that will produce enough people taking the EMS courses to spend all the money. So we are requesting some increases. We had some discussions on what happened during the pandemic. Spending on training and education dropped during the pandemic. I think there's no surprise as to why that. A lot of classes got shut down. A lot of classes that might have happened wouldn't have happened. We're coming out of that time. We've got to ramp back up. We've got to ramp back up for 2 reasons. Number one, because it's hard to request a budget and spending level if you're not going to use it. And number 2, because we have seen, as I said just a few moments ago, a 17.5% decrease in the number of people that are certified and working. Clearly, we have to help create the demand, and the state will help us to finance their training. So I think that a 2024 project for us is to help find ways that we can create that recruitment and retention necessary. So with that said, I would like to move forward the following motion. My computer just took it away, so give me just 1 second. The resolve that SEMSCO forward the following recommendations to the New York State Department of Health for state fiscal year 24-25, aid to localities, special revenue budget, training and education reimbursement, $7.1 million, EMS program agencies, $4.3 million, REMSCO's $500,000, total $11.9 million. Further, the SEMSCO endorses the Finance Committee's accompanying programmatic recommendations for submission to the Department of Health.
Any discussion?
Is that a seconded motion, sir?
Yes, it is.
Okay, thank you.
Just a comment, Mike. I want to thank the committee's work for that. It's been monumental. One word of caution, though. We've been decreasing our education due to most providers got a 1 year and then an additional 1 year extension. So I wouldn't look at the numbers currently as reflective of what the training and ed will be. I know all the core sponsors out there have had a decrease in CMEs and decrease in regular classes. That doesn't affect originals. I'm talking about for education budget as far as the 2 extensions that were awarded during COVID did reflect on the lower numbers. So I think this year we'll have a better and a higher number to assist finance with needs of training and ed.
Yes, and Drew advises that they may be taking a year back from everyone in order to accelerate that process. Any other?
If I could, Mr. Chairman.
Go ahead, Al.
I've said at most of the meetings here, we need people. We need to accelerate these programs to turn out more people to fill our ambulances. We still have empty ambulances sitting we can't staff. We can't let this continue. And I'm hoping that what Steve is doing and what William is just saying, things are going to move forward more rapidly now. It must, because we're concerned, always concerned about attrition. How many people are going to leave? And the report he's giving out, we're going to lose people. So we can't have a deficit going forward with trained EMTs and paramedics. So I appreciate everything everybody's doing. We need to just work harder getting our program agencies to turn out more quality paramedics and EMTs. Thank you.
Thank you. Can we have a roll call vote on this since this is a statutory obligation?
Mr. Chair, before the vote, may I?
Go ahead, Mark.
Thank you, Mark Philippi. Mr. Lewis set me up very nicely for this with mentioning the program agencies. Many of you know that I've been a staunch advocate for the program agencies throughout the state. I applaud the committee's work in recognizing what they have done and the need to further support them. One has only to sit at any committee level meeting over the last 2 days to hear the number of times the words program agency comes up. They are consistently and constantly being asked to take on a sizable amount of work, to which we appreciate tremendously, but with very little increases in their budget over the last 20 years. So this is monumental, and I applaud everyone to come together with this, most particularly the department's budget folks to come forward and give us some really practical advice and some really good guidance on how to make this work. So thank you.
Thank you. Any other discussion? All right. Can we call the roll?
Steve Cady.
Steve Cady, yes.
Scott Clark.
Scott Clark, yes.
Dr. Krupe.
Robert Krupe, yes.
Mark Devers.
Yes.
Don Duval.
Yes.
Mickey Fornes.
Mickey Fornes, yes.
Jason Haig.
Jason Haig, yes.
Teresa Hamilton.
Teresa Hamilton, yes.
Don Hudson.
Hudson, yes.
Dr. Isaacs.
Doug Isaacs, yes.
Al Kim.
Yes.
Steve Kroll.
Steve Kroll, yes.
Andrew Knoll.
Andrew Knoll, yes.
Al Lewis.
A yes with a great job, team. You did all good stuff for this EMS system.
William Masterton.
William Ashton, yes.
Mike McAvoy.
McAvoy, yes.
Mark Philippi.
Philippi, yes.
Marianne Portoro.
Marion Petoro, yes.
Dr. Raybridge.
Raybridge, yes.
Dr. Redlener.
Redlener, yes.
David Simmons.
Simmons, yes.
Carla Simpson. Christopher Smith. Chad Smith.
Chad Smith, yes.
David Violante.
Violante, yes.
Motion passes.
Thank you.
Thank you very much. The final document will be posted to Boardable, and I encourage you to use it not for the numbers funding request that we have in there, but for the accompanying language of ideas. It talks about some of the things that are currently in pilot programs that you can utilize that Ryan mentioned in the Bureau report. Talks about some of the ideas about innovation in education and training. It talks about some of the things that the program agencies are doing that are innovative. And it really can be a resource to you in your regions and for activity. And it also could be a resource for us at our committees here as we continue with our work, since it's a compilation of ideas. We did identify a few things in the latter portion of our meeting yesterday that will be our ongoing work. First, there is definite consideration of whether course reimbursement is sufficient. We did get a 35% increase in the basic EMT and AEMT course reimbursement this year, but we acknowledge it is still below the cost of delivering the courses. We are going to look at it again at this time next year, give the new rates some time to settle in, see what the impact is on course sponsors. And so I suspect that at the September meeting, we will have a discussion next year about are further increases warranted for the next cycle. But, we saw 2 increases this year that were significant. Secondly, there was some real discussion about the risk-sharing model for students, and there's a diversity of opinions on this, but we still have the issue of a student that goes all the way through a course and does not complete certification, that the course sponsor is generally left holding the financial bag, basically. There's no reimbursement from New York State, and the course sponsor has spent the resources. There's a lot of opinions on this. Students should be held accountable, instructors should be held accountable, but right now all of the risk goes to one place. That's the course sponsor that took the chance on educating a student. And, the student may have made it 95% through the course and just not passed the practical, may have not taken their state certifying exam. The sponsor then has to eat it. And of course, most of our course sponsors are small businesses in one way, shape, or form, whether they're government agencies or whether they're not-for-profits or whether they're part of a for-profit training center. So I think there's a need for discussion about some sort of risk-sharing model. That opened up a broader discussion that I think belongs in the venue of the training and education about, is our educational model the right model for the long-term future? And I think we'll be doing some more talking about that. The last thing I'll mention is that we approved this on December 6th. The due date was December 1st. I think we're being given a little bit of an okay pass that, they're going to look at our paper, and indeed they know what was coming. But next year, we just have to accelerate and finish this at our September meeting so that it is in ahead of the deadline. Thank you very much. It's been a privilege to work on this.
Thank you. Any questions for finance? All right, I see a lot of people twitching because of their bladders being full, so it's 3:14. I'd like to call a 10-minute recess, come back at 3:24.
How does he see my bladder?
Now that I made it quiet in here, the director has taken a couple minutes with the deputy director, and they shall return in a moment. All right, let's do this. We'll skip over systems for the moment and do another committee report. Where is Al? All right, how about safety? Andrew?
Excellent, thank you, Chairman McAvoy. We have a second motion to bring forward regards to proposed revision 10 NYCRR Part 800.21P. And I'll let Mark Philippi talk a little bit about that proposed change, as Mark was instrumental in engineering.
Thank you, Andrew. So this has been a long-term project, just a very, very brief history. This goes back to a request of the Safety Committee back about 8 years ago when I first came on council. We were tasked with revising then Bureau Policy 0013, which if you look back in any of the SEMSCO minutes for the last 8 years, probably been mentioned about, I don't know, a dozen or so times. In the current environment, and thanks to the efforts of the director and the department in trying to reframe how we as a council address some of these issues, the impetus to revise a policy is probably less so than coming up with an idea of some potential regulation that would help to guide safety. I think we can all agree that safety is important to all of us. It's important to our practitioners, it's important to the public, and therefore some of these elements should be a matter of regulation rather than a straight matter of policy, which someone could legitimately and potentially ignore. So that is the foundation. We approached this in two different aspects. Aspect one was to craft some language that we hope will be considered by the department as a potential regulation addition to 821, which is the section that deals most with regulations regarding ambulance service and agency leadership. Section P has a lot of subsections, but notably it has a lot to do with what providers are required to do and what agencies are required to have as policies. So it's very similar in a lot of ways to the Commission on Ambulance Accreditation in that it requires you to have a policy for X. So what we had done here is taken that piece of the 0013 language, crafted it into what is on the screen now and what has been put up in Boardable as a suggestion for the department to consider as something for a regulatory revision. Without reading each of these statements, I think most of these are pretty boilerplate and straightforward. For example, a statement regarding exceeding posted speed limits and the maximum allowable speed during emergency operation. That has been something in the recommended policy language in 0013 for decades. This would now require agencies to establish that as a matter of policy. It doesn't say what those speed limits must be, it just says that you must have a policy that addresses those things. Another important one, after the work that the committee's done on provider fatigue and provider resiliency over the last few years, is a statement regarding driver fatigue and maximum hours of service. Again, this was something that came up a number of years ago after some rather horrible circumstances in New York State, and we want to get ahead of this in a way that would provide some support and consideration for those incidents before, while still keeping in mind that we want to keep our providers safe, and we want to keep the public safe. So all of those sections will hope to, and seek to do that through regulatory change. The second piece of this, which is currently out for council and committee comment, is the draft best policy or best practices document. I'm trying to avoid calling it a policy because it's really not. It's a draft best practices that we hope agencies can take and use to meet, at minimum, the standards that we're looking to establish in this regulation. So the draft policy would mirror the requirements of these regulatory changes.
Thank you, Mark. We move for discussion.
And this was posted on Boardable as well. So any discussion on the motion? If not, I believe this requires a roll call vote. So we could call a roll, please.
Steve Katie.
Steve Katie, yes.
Scott Clark.
Scott Clark, yes.
Dr. Krupe.
Rob Kuby, yes.
Mark Devers.
Mark Devers, yes.
Don Duval.
Yes.
Mickey Fornes.
Mickey Fornes, yes.
Jason Haig.
Jason Haig, yes.
Teresa Hamilton.
Teresa Hamilton, yes.
Don Hudson. Dr. Isaacs.
Doug Isaacs, yes.
Al Kim.
Al Kim, yes.
Steve Kroll. Andrew Knoll.
Andrew Knoll, yes.
Al Lewis. Not here. William Masterton.
William Maston, yes.
Mike McAvoy.
McAvoy, yes.
Mark Philippi.
Mark Philippi, yes.
Marianne Portoro.
Marion Petoro, yes.
Dr. Raybridge.
Raybridge, yes.
Dr. Redlener.
Redlener, yes.
David Simmons.
David Simmons, yes.
Carla Simpson.
Carla Simpson, yes.
Christopher Smith. Chad Smith.
Chad Smith, yes.
And David Violante.
Violante, yes.
Motion passes.
Thank you.
Excellent. We also continue to work on the management of escalation tactics that Mark and Brian have been working on. We've created 2 subcommittees to address a few things, looking at disaster guidelines, best practices that we will hopefully get out to agencies and providers and county coordinators in the next year or so, looking at disaster responses and also taking those best practices to say, this is how you can get certain resources, how you call on that. Carol Brandt has offered to chair that committee. So we look forward to working with her, Gina and Steve from the Bureau. And then we created another subcommittee to start working on the reduction in the use of lights and sirens, which is going to be chaired by Susie Supernot, aka Scott Clark. So we look forward to that. End of my report. Thank you.
Thank you. Any questions for Andrew? All right. I'm going to continue jumping ahead here. Quality metrics. David?
Great, thank you, Mr. Chair. A lot of activity on the Quality Metrics Committee. We've done a lot of work with our QI manual that is up on the state webpage under quality in there under operations. So please take a look at that, spread that around, share it with your friends, family, agencies, providers, et cetera. A lot of good information, especially in the back. There's a quick start guide to help agencies start their own quality improvement process. Also, we're going to be putting up on the website measures, quality measures and metrics by SEMSCO, the AHA, FAIR, et cetera. And those will be on there for folks to be able to see, be able to use. It will have all the information they would need to create the run charts for their own internal quality improvement program. I have to say, as I was up there looking at that, kudos to the state and to Ryan for working on the website and including the committee descriptions on some of the front pages of the website. One of the things that we had talked about yesterday in our committee was having a lot of people come to the table. There's a lot of folks that come to these meetings. There's a lot of folks that have a lot of amazing ideas. come to the table, talk to us, and not just my committee, but all these other committees. And so there's descriptions on the website of what each committee does. Take a look at that, go there, talk to those folks, and become involved. This is our council, right? And so everybody should have a voice with that. So great work with that. We had a great pre-conference at the Vital Signs Conference by NAMSP on quality improvement. And unfortunately, there were only a handful of folks there. There were only 12 people that went, but it was really an amazing, good conference. And some of the things that came out of that was that it's QI, but it's also leadership. And so we're looking at maybe moving that to a one-day program and rolling that out in future conferences and on Vital Signs Academy, our considerations. So we've done a lot of work. Where do we go from here? We are looking at our committee now moving forward. The next big piece is to look at engagement with providers, with agencies, with regional councils, with program agencies, et cetera, to do training, to do some development, to work with access to data, and to get data back to folks, right? So it's great if we put things in, but if we don't get things out of it that have an influence on what we do and how and why, then there's a problem with that. And so we're working on both of those sides to it, of getting data in and getting data out. It's also incumbent upon us as individual providers, as agency leaders to help make this possible for us to document and put the things in, because if you don't have good data going in, you are not going to have good data coming out. And so that's absolutely important. So we want to get that data, get it out to the regions, send it out to the agencies, partner with medical directors and agency leadership. And again, please come to the table. Let us know how we can help and support you. Literally, honestly, please reach out. So that's sort of what we're doing moving forward here. Other components we had talked about with the DI team, we are working with them weekly on data, following the data, tracking the data, getting the data. There's a lot of work with that. Director Greenberg talked about the movement to 3.5. That's fantastic. We're looking forward to that as well. Our team also worked on the policy tag 1202, 1203, and 2104 related to PCRs, ZPCRs. We coalesced those three different policy statements into one recommendation, and that is now at the state for consideration by the Bureau, and we're looking forward to that coming out. That's what I have at the moment, Mr. Chair, for quality metrics. In case there's any questions for me, please let me know, and then I'll move on to IGEL if that's okay.
Any questions about quality? All right, IGEL.
Okay. With the HV-REMSCO doing the IGEL data, we have to date 140 applications. Of those 140, 80 are active agencies. Some of those folks haven't moved forward because they're in the process of training and getting equipment and this and that. So we have 80 active agencies. We have over 1,000 EMTs trained in doing IGELs. And through all of the data we're able to get and continue to get, we have about 150 insertions. Which is fantastic. And the data demonstrates that, yes, it is absolutely possible for EMTs to insert an IGEL. And so we'll continue on with this and fill out the remaining kind of data that we're looking at and needing and continue to report on this. We've been reaching out to agencies in the past, since the past meeting, and a lot of folks are really stoked about having something that they can do and doing it. And this has just been a great program. So kudos to the agencies for getting this underway, and for all of the EMTs that are doing it, and all of the paramedics that are also mentoring on the sidelines and verifying the insertions and such. There's a lot of great things happening. So that's what's happening with IGEL, and can continue to stand by and hear more about it.
Any questions about IGEL? All right. If not, I want to jump to innovations and research. Jason?
All right, first I'd like to thank Steve Blocker and Steve Kroll for filling in yesterday in my absence. I took the time to attend my son's chorus concert where he had a solo. So a little bit of feedback on the infographics. Feedback from the committee that we've been working on the infographics for a couple of meetings. Some feedback is that it needs to be a little bit more fully detailed and more of an ad, so we're going to work on that. We're going to reach out with the mobile integrated health study from NAMT. We're going to reach out to some agencies that are running it and see what KPIs that they're looking at and the like. And we want to focus a little bit more in the future on identifying some innovations that people are already doing, REMSCOs, program agencies, specific agencies and the like, throughout the state. Have them bring them forward and push them out and really give these folks a mountain to shout from with their innovative things that they're doing. Maybe do a little bit of a road show or something similar to that. We even discussed even this morning at executive about the possibility of having a Bureau of EMS podcast and highlight some of the stuff on there. So just some ideas, nothing set in stone yet, but that's really something that the committee is going to move forward to do. And also we talked about reaching out to students and asking them to identify to us as a committee what things they've noticed in their education might be innovative to bring to the floor as well. So that's all I've got. Sounds like they ran a great meeting and had a lot of good discussions. I'll entertain any questions. Excellent.
All right. And I apologize for inadvertently switching you from first vice chair to second vice chair this morning, or this afternoon.
Oh, that makes me younger if I'm second, right?
The DEI tag, I'm going to skip over on purpose this time, not inadvertently. They have met and put out their survey, which is on the Bureau survey page, and they're still looking at responses coming in for that. So if you, I think it's not fully representative of the state population at this point. So Dr. Raybridge and his colleagues would appreciate you sending that out to people to complete, and then they'll start tallying those results and have a report for us at a future meeting. They are on the EMS forms page. EMSC, Amy?
Good afternoon. Amy Eisenhower, EMS for Children Program Manager. Dr. Cooper has another engagement and has asked me to give the report for the EMSC meeting, which was held on Monday. So the Always Ready for Children Pediatric Recognition Program and ED Pediatric Emergency Care Coordinator Program continues and is underway. We have our first two applicants, which we are very excited about, and they will be, they are in review and will be notified shortly. I do know we have some other hospitals that have been working on their surveys, asking questions, some of them specifically related to ACS verification and re-verification, but many because they are interested in ensuring their pediatric readiness. So we're excited about that. I know Ryan mentioned our work with the SEMSCO Safe Transport of Pediatric Patients Standard Suggestions. So essentially, our suggestions for how to verify that the pediatric restraint devices and car seats are safe in ambulances, because as we have discussed previously, there are no current standards. So that work is ongoing. The hope is that those work groups have their recommendations done within the next few months, so that by the end of a year of the work, that document will be complete and can go to SAE for review and questions, and then move into the next stage of working towards getting all these devices tested to an American standard. We also, several of the EMSC program managers have been chatting with SEMSCO about how we can look at this and get more information on how we're transporting pediatric patients, so that we can be better informed about that and how we roll out education and inform EMS providers on best practices in the future. We also have a new pediatric assessment triangle document. It is the same document. There were some minor revisions requested by the protocols committee. So Dr. Cushman brought some some questions to the committee. The committee reviewed the document. There were some minor edits. So we have edited that. EDCC approved it, and our committee approved it. So currently it's with PAG for printing, and I will send out an email to everybody once the PDF is on the website. And of course, as everybody else has a form, there's a pediatric tools form, so you can order badge buddies and these PAT documents through that form. And I will make sure it's on the forms page for all of you to use. We did have also another tool review, so much thanks to Megan Williams from BMCC and her students for doing some legwork for us of reviewing a variety of length-based measuring tapes. So Hand Heavy and Broslow, as well as some other devices that are similarly tooled, and how those might work with other apps, other devices, if there's dosages involved, what medications are on there, what medications are missing. So there was a variety of information that even was not anticipated that came up. So that work will continue in talking with some of the manufacturers of these devices and exploring, best practices for them. So that will be ongoing. We also had an update by PCARN, which is the Pediatric Emergency Care. It's the research arm of EMSC. So sadly, Dr. Brooke Lerner passed away from a long-term illness in the last few months. And Dr. Clemency has kind of stepped up in the western region out in Buffalo to fulfill her role on many of these projects. So Dr. Clemency and Dr. Peter Diane came and talked to us about an update on some of the studies that have been ongoing, but also to talk to us about the T-REX, not with an X, sadly, but T-REX, so Treating Respiratory Emergencies in Children project. So essentially, New York, actually, our protocol already mirrors best practices and what they want to do. So this was not so much a protocol request as they have come to us in the past, but saying, this is what we'd like to do. We already kind of do that. Do we have your blessing? So they went over some of the project specifics, and the EMSC gave their blessing. So the plan is to start, I believe, enrolling patients in January. So that is a research project that will start very soon, and we're very excited for it. Also, there was a review of a SEMSCO letter that came out in 2022. So the initial letter was sent out and made aware to the EMS community about using appropriate defibrillator pads with their appropriate device, which seems like it should make sense, but apparently there are some aftermarket distributors. Those devices don't fit with certain monitors, and it doesn't work as well and causes problems. And I'm sure that none of us want to have that kind of problem. However, also in that letter, it was noted that there was some difficulty with LifePak 12 and LifePak 15 and not having a pediatric AED mode. So it can shock pediatric patients in manual mode, but the difficulty comes when BLS agencies use monitors for BLS 12 lead, and they also happen to use those monitors for other things. So there was some discussion about that. We will be working on kind of a cover letter with that from Dr. Vanderyak and Dr. Cooper and redistributing that with succinct information. Our next meeting is February 1st at 1 p.m., and that will be virtual via WebEx. My hope is to have all of that information and announcements up on our websites shortly. I can also give the PED stack report if you'd like it now, or I can wait till later.
Let's hold off on it for now.
Okay.
Any questions for Amy about EMSC? If not, Steve Brocato, do you want to give a brief report on rural health? All right, let me, you want to do it?
So rural health continues. Like I said, I think in my staff report too, we're excited. We had the first town hall on Monday evening. We have a second one tomorrow afternoon via WebEx. We have a third one on Sunday via WebEx for anybody who would like to join. There's a QR code, I think, on the table if the flyers are there. Does that sound right? No. We will get the QR code shared for anybody who would like to register so that they get the information for it. Please share it widely. We're looking for feedback with that, so really appreciate that one. And then hopefully a report sometime probably in Q1 of next year. So that's what we're looking at.
Good. Thank you.
Oh, and their next meeting is tomorrow. Here.
Right. There are two other groups, just to give a quick synopsis on. One is credentialing, and Paul Barbara from Northwell, who is the physician who chairs the credentialing for New York City, is leading that group. It has about 60 people on it, half of whom are physicians, and they've had 2 meetings. They have 2 more scheduled. They've discussed a little bit about definitions for credentialing. Their charge actually is to come up with a best practice document for credentialing, and also to come up with some proposed regulatory or policy changes that might be necessary in order to facilitate that in the future. They expect at their next meeting to have a straw man document that they're going to start banging away at. The other work group is performance standards, and is Mark Philippi here? Oh, there he is. Usually you sit up here, and so the fact that you're down there is you want to be by the Christmas tree because you look like Santa Claus. Tell us about performance standards.
Ho, ho, ho. Thank you, Mr. Chairman. So the group has met twice to establish some baselines as to what the expectation is. I've established 4 subgroups, one for each of the 4 committees' submissions. I have leads for each of those groups, and I'm going to meet with the leads tomorrow, I think. I think it's tomorrow, to try and good level set to the expectations so that we can make sure that we have everything done by the deadline. A couple of them are pretty straightforward. I don't expect a ton of work needs to be done. A couple more are going to require a little bit of pairing. So that task is going to fall to these groups, and I've tried to align the number of people in each of the subgroups to tackle those. So it should be, keep fingers crossed, working right along.
Thank you. Jason, why don't we do the elections, and then we'll have Mr. Lewis do the legislative report, and then we'll come to systems.
Okay. All right, so the positions of nominations for the offices of chair, first vice chair, and second vice chair may be made from the floor by any member of the state council up to and including this time. Are there any nominations from the floor? Are there any nominations from the floor? And for a last time, are there any nominations from the floor? Seeing none, I'll declare the nominations for chair, first vice chair, and second vice chair closed. Okay. So, for the position of president, and since these are uncontested, we'll do these elections simply by a show of hands by vetted state council members. Mike McAvoy has been nominated for the position of president. Mike, do you accept this nomination?
I would prefer to be the chair, not the president.
Sorry, president. President, chair, doctor, director, guy. Mike McAvoy has been nominated for the position of chair. Mike, do you accept this nomination?
Yes, I do.
Outstanding. All right. I move to close the nominations for the office of chair. Do I have a second?
Second by Al Lewis.
Second by Al Lewis, thank you. All those in favor? Raise your
Aye.
hand. Any opposed? Any abstentions? So moved. David Violante has been nominated for the position of first vice chair. David, do you accept this nomination?
I do, thank you.
All right. All right, so as we have an unopposed candidate and our bylaws do not require this vote by ballot, all those in favor, raise your hands. Any opposed? Any abstentions? Okay. All right. And Terry Hamilton has been nominated for the position of second vice chair. Terry, do you accept this nomination?
I will with thanks.
All right. So we have an unopposed candidate, and our bylaws do not require us to vote by ballot. In such circumstance, we hold a majority by show of hands. All those in favor? Any opposed? Any abstentions? All right. Motion carried. Ms. Osga or Ms. Allen, we're going to request that the commissioner designate an officer or employee of the department to act as secretary of the state council, which I believe they've already done. So I think we are all set there. Mr. Chair, this concludes the elections for council positions.
Thank you, sir. And thank you for your service as first vice chair this past year.
It has been a pleasure. Thank you.
Going completely out of order still, Mr. Lewis, would you mind giving the legislative report?
Just an out-of-order comment. So, sure. There wasn't a lot happening in December with SEMSCO legislative. We did get into a discussion about regulations, and regulations has been added to part of our charge with this committee, and I'd ask Director Greenberg if he could talk about that for a few minutes on how that will proceed to happen. Thank you, sir.
Yeah, no, my pleasure. So I'll keep it pretty short, but just a little bit. So as we start to move in, again, it's been about 20 years since, or greater than 20 years since we've done some regulatory changes. And we're trying to look a little bit into the future. We have these regs, the blood regs, CP regs, safety regs are done, but there's just a lot of regulatory stuff that is coming up, exciting stuff, I think, in the big picture of things. And, you know, right now it kind of moves between different councils and different groups, as well as also trying to figure out what the top initiatives are for other regs that might need to be updated, like trying to figure out, you know, what's the next top 3 sections that need to be reviewed and updated. You know, as we look at our education regs, we're taking out terms that say, you know, use the textbook from 1998. So there's some opportunity to, you know, modernize some of our regs. And so as we look at that, we're thinking that it might be best to centralize, at least even where the process starts, to still keep the subject matter experts involved in that process. So it might, you know, move to a committee based on the work that needs to be done, but to start in one section and kind of be centralized and to stay focused on what we're, you know, kind of looking at in our priorities. And Chairman Lewis to sit there and to, you know, be able to navigate that. And so that's a little bit about what we're looking for and in the charge and changing charge, not only, you know, just from the legislative committee, but now also legislative, what's happening outside, but regulatory, what's happening inside, and to help in that coordination, identification, and to move things forward.
Thank you, sir, very much. That's the end of my report.
Thank you. Well, I saved the best for last. Mr. Devers, you have roughly 2 hours to finish it.
Good evening. The Systems Committee met yesterday, and we'll start with 4 seconded motions, and we'll start with the town of Alden. Sorry, I lost my paper that was up here. I buried it. So the Systems Committee voted to uphold the June 2019 determination by the Wyoming Erie Regional SEMSCO, which denied the Lancaster Volunteer Ambulance Corps application for establishment of a new ambulance service within the town of Aldine. This is a seconded motion. So is there any discussion? Actually, before we start, does anybody have a conflict on this specific CON action? Hearing none, is there any discussion?
Steve Katie, what was the determination, so it's on record, of the Wyoming Erie Regional Council?
They denied the application for the CON. This is the CON where the town has a CON and they are operating under that authority currently. There's no discussion. Mr. Chair?
This will be a roll call vote. Before we vote, if you vote yes, that means
If you vote yes, you uphold the SEMSCO's decision to deny the CON.
okay. Could we roll call vote?
Steve Katie,
Steve Katie, no.
Scott Clark,
Scott Clark, yes.
Dr. Krupe,
Robert Kuby, yes.
Mark Devers,
Mark Devers, yes.
Don Duval,
Duval, yes.
Mickey Fornes,
Mickey Fornes, yes.
Jason Haig,
Jason Haig, yes.
Teresa Hamilton,
And Teresa Hamilton, yes.
Don Hudson,
Hudson, yes.
Dr. Isaacs,
Doug Isaacs, yes.
Al Kim,
Al Kim, yes.
Steve Kroll,
Steve Kroll, yes.
Andrew Knoll,
Andrew Knoll, yes.
Al Lewis,
Al Lewis, yes.
William Masterton,
William Maston, yes.
Mike McAvoy,
McAvoy, yes.
Mark Philippi,
Mark Philippi, yes.
Marianne Portoro,
Marion Petoro, yes.
Dr. Raybridge,
Raybridge, yes.
Dr. Redlener,
Redlener, yes.
David Simmons,
David Simmons, yes.
Carla Simpson,
Carla Simpson, yes.
Christopher Smith,
Chris Smith, yes.
Chad Smith,
Chad Smith, yes.
and David Violante.
Violante, yes.
And motion passes.
Thank you.
Our seconded motion is the Village of Alden. This is an appeal on the September 18th, 2019 determination of the Wyoming Erie Regional Emergency Medical Service Council, which denied the Lancaster Volunteer Ambulance Corps' application for establishment of a new ambulance service. And just like with the town of Alden, there is a municipal CON that they are currently operating under. Does anybody have a conflict with this specific CON? And if not, is there any discussion? Maybe we should do CONs at the end of the meeting more often. Mr. Chair?
We'll take a roll call vote. If you vote yes, that indicates that you are upholding.
Upholding the SEMSCO's decision to deny the CON.
Thank you.
Steve Katie,
Steve Katie, no.
Scott Clark,
Scott Clark, yes.
Dr. Krupe,
Robert Krupe, yes.
Mark Devers,
Mark Devers, yes.
Don Duval,
Duval, yes.
Mickey Fornes,
Mickey Fornes, yes.
Jason Haig,
Jason Haig, yes.
Teresa Hamilton.
Teresa Hamilton, yes.
Don Hudson.
Hudson, yes.
Dr. Isaacs.
Doug Isaacs, yes.
Al Kim.
Al Kim, yes.
Steve Kroll.
Kroll, yes.
Yes. Andrew Knoll.
Andrew Knoll, yes.
Al Lewis.
Yes.
William Masterton.
William Ashton, yes.
Mike McAvoy.
McAvoy, yes.
Mark Philippi.
Philip, yes.
Marianne Portoro.
Marion Vitoro, yes.
Dr. Raybridge.
Raybridge, yes.
Dr. Redlener.
Redlener, yes.
David Simmons.
David Simmons, yes.
Carla Simpson.
Carla Simpson, yes.
Christopher Smith.
Chris Smith, yes.
Chad Smith.
Chad Smith, yes.
David Violante.
Violante, yes.
Motion passes.
Thank you.
Our next appeal is an appeal on the September 15th, 2022 application of Scarsdale Volunteer Ambulance Corps. The seconded motion comes to uphold the February 2023 determination of the Westchester Regional Emergency Medical Services Council, which approved the Scarsdale Volunteer Ambulance Corps application for the expansion of ambulance service primary operating territory. Before we get started in discussion, does anybody have a conflict to declare?
Chairman Devers, if I could, Al Lewis.
Yes, Mr. Lewis.
Thank you. Well, there's a perceived it is perceived I have a conflict. I don't believe I do. And how does this body address whether or not they believe I have a conflict? Let me share with you a few minutes. I represent the ambulance industry, the proprietary ambulance industry. I've done that for many years. I have absolutely no pecuniary interest in this. However this vote comes out, it doesn't affect me or Onion in any way. I believe I have the right to speak on this. And also, I believe I have the right to vote on this. There's differing opinions from the Bureau, DOH. But how do we resolve this? I think we should resolve it according to bylaws. So, Mr. Chairman, I turn it back over to you.
Dr. McAvoy? Do we know what our bylaws say?
In our bylaws, it indicates that an individual who declares a conflict would then be determined whether or not they can vote by the members, the seated members of the body. The Division of Legal Affairs has advised us that that bylaw statement conflicts with public officers law, and hence what we saw yesterday, where the declaration of a conflict resulted in Mr. Lewis being asked to recuse himself. And so that's where that stands. I would say at this point that we need to make a decision about how to proceed. So I will open that to discussion, et cetera.
Mr. Chair.
Go ahead, Mr. Philippi.
Thank you, Mark Philippi. I had the opportunity to make a phone call to COREG, which is the ethics department, through their hotline. Spoke with an attorney named Erin. She then referred me to the department's ethics department, and I spoke with a gentleman named Matthew Pagula this morning. where both attorneys opined that the perception of a conflict is part of the concern. The other issue that both attorneys said to me was that your bylaws should have holding. So I'm not sure where the conflict resides. I spoke with two attorneys who represent ethics branches or departments, and they were both saying that your bylaws has standing. So I offer that, although both also said in full disclosure that the issue of perception is important. The perception of conflict often has some bearing, and also the issue of recusal and how that's handled. We don't address how recusals are handled in our bylaws, but again, I don't think that's the issue at hand right now. It's the whether or not there is a conflict and how we determine that.
Do you have a recommendation for this body?
My recommendation is we follow our bylaws. That's what's in writing.
Excuse me, is there a severance clause in our bylaws that would recognize that public officers' law would dictate in circumstances where it contradicted our bylaws? Typically, bylaws have a severance clause that does that.
The bylaws also state that the members would comply with public officers' law. So there could be a conflict in the bylaws.
Unfortunately, that sounds like a severance. I'm no lawyer.
So do you have a recommendation?
Does anybody have the pertinent section of public health law that we could maybe read? Or could be read to us? Or public officers law, I'm sorry, not public health law. Like I said, I'm no lawyer.
Hi, my name is Wachia Kasmi. I am an attorney for the Department of Health, Division of Legal Affairs, counsel to Bureau of EMS, as well as SEMSCO. It is our recommendation that any Onion member or REMSCO representative recuse themselves during this conversation, and that the SEMSCO vote to not allow members with a perception of a conflict to vote, and that they should be recused. The bylaws also do say that Public Officers Law, Section 74, is applicable to members.
So, Mr. Chair and Mark Philippi, due respect, again, we're dealing with the issue of perceived, right? So there's a perception that Mr. Lewis does not share. So in order for that perception to become something actionable, in my opinion, requires the body to decide, is that, in fact, do we believe as a deliberative body that that is a conflict? So perception is not reality, at least until we all agree that it is. Further, I've been given some opinion documentation from the Committee on Open Government that is pretty on point regarding this, and the opinion issued by Executive Director Robert Freeman in February 27th of 2021 from the Committee on Open Government deals with a person who was directed to leave in that instance because of a perception of a conflict. In that instance, the opinion was that the person did not have to leave. So with respect to that piece of it, I think there's opinion available, but again, I think the issue is whether or not there is actually a conflict and whether we agree.
So in order for this body to make that decision, there would have to be a motion for them to vote on.
So then, Don Hudson, on the question, is the question before this body whether there's a conflict or not, whether he can vote or not, or whether he can speak or not?
Whether there's a conflict or not.
And the definition we're utilizing for conflict is some sort of financial or personal benefit at stake. Is that correct? in layman's terms,
Mr. Chair,
a layperson?
I have Section 74 of the Public Officers Law pulled up. Section 74, paragraph 2, rule with respect to conflict of interest. No officer or employee of state agency, member of the legislature or legislative employee should have any interest, financial or otherwise, direct or indirect, or engage in any business or transaction or professional activity or incur any obligation of any nature which is in substantial conflict with the proper discharge of his duties in the public interest. That is Public Officers Law's definition of a conflict of interest.
May I ask a question? Mr. Philippi has already brought up the question as to the difference between a perception of conflict and an actual conflict. I think that has to be defined, and this body should have guidance on how that is defined. So that's number one. The second issue is Mr. Lewis does not believe, he just heard that definition that Mark read, and he does not believe that he has any of those things that would be a conflict. I would like to know why he believes he does not, and I would like to know why the department's advice would be that he does. So there's sort of a process that, and I know it's 4:30 and we're supposed to leave, but there's a process that has to play out here. You know, number one, I have to understand as a person here whether he is, we are saying that whether he is perceived as having conflict or whether he has a conflict, and what the difference between those two things is. Because perception is not necessarily reality. And then, you know, Mark read the statement. It's relatively broad, right? I think what Mr. Lewis is saying is that while I am serving in the following position, I do not believe that is a conflict. And according to our bylaws, we're supposed to judge whether that is the case. I recognize we're being told, well, your bylaws conflict with certain precedent, but they still are our bylaws, and I think that in the longer term, we have to figure out how to straighten that out. But today, those are our bylaws.
So would it be fitting then procedurally to first take a vote to adhere to our bylaws for the record?
I don't think you need to vote on whether you're going to adhere to your bylaws, because if you don't, you didn't.
So, and I'm glad you put it that way, because now that being stated, how do you then prove something that's not a reality? And this is why, again, without being an attorney, I would submit as a layperson, my understanding of burden of proof is that unless somebody has proof that there is a conflict, then by nature there is not one.
But you also heard perception referred to. Perception would be the decision of this body.
Well, and your perception was that Mr. Filippi wanted to sit near the tree to look like Santa Claus. I don't agree with that perception, however, you're entitled to it. Just remember me in a few weeks when you visit the house.
So I would suggest that this could be resolved if we were to take a vote to say whether this body feels as though there is a conflict or not. And that is everyone's perception.
I would move to declare that we see no perceived or actual conflict of interest with Mr. Lewis's declaration.
Could I ask that that be amended, that we do not as a body see an actual conflict of interest, as people are entitled to their perception?
While people are entitled to their perception, I think my motion would speak that we don't as a body perceive a conflict of interest. But if you'd like to amend it, I'm amenable to the amendment.
Well, in that case, I'll second your motion.
And the motion is,
I'd move that after Mr. Lewis's declaration, this body agrees that there is no perceived or actual conflict of interest that we see.
Before we vote, I agree that I would like to hear from the attorney as to why there is a perceived conflict, and from Mr. Lewis as to why he perceives that there's not a conflict. It's hard to vote until we hear all the testimony, as it were, the data.
Point of order, Mr. Chair.
go ahead.
I'm sorry, and I really, really hate to do this, but I think we're heading into slightly dangerous territory, particularly when we were asking directly for an opinion from an attorney. I would ask that we enter executive session.
So you're making a motion to enter executive session?
To discuss legal matters with our attorney, correct?
All right. Second to that motion?
Steve Katie will second.
All right. All in favor of entering executive session, raise your hand. Keep your hands up for a minute. All right, all opposed? Any abstentions? All right, so we're in executive session. If we could stop the recording. Yeah, I think
Sorry, Mr. Chair, another point of order. Just for the purposes of the record and for Ms. Osga as Executive Secretary on your behalf, we exit executive session with no action taken on the matter.
Correct. And then are we back recording? Let us know when we can start. Good? Okay. Back on the record. We do have a motion on the floor, which is whether the membership feels that Mr. Lewis is in conflict or not. And the motion, I believe, if you vote yes, says that he is not conflicted. Correct?
As the motion was seconded, it would be, yes, there is a perceived or a real conflict. No, there is not a perceived real or conflict.
All right. So yes vote, we perceive he has conflict, and no vote, we do not.
Right.
It did.
It did.
So I will call a vote for that motion.
Maybe I misunderstood. My take from the executive session was that we were going to table that until we had more legal information. I could be wrong, but that was my understanding, that we would not vote on that, but we would get more information before we voted.
This is not a vote on the CON action. This is a vote on whether this body perceives or sees a conflict.
But that's what I felt I needed guidance on.
Two separate issues.
If you like, you can make a motion to table this motion.
I need to make a motion to table.
Do you have a second to that?
Or could the original motion be withdrawn also? And then we table?
Respectfully, I choose not to withdraw the motion, and the reason for that is, depending on the outcome of the ongoing legal debate, it's one question we've already solved. And a piece of information that can be used as they continue the legal guidance or the legal opinions that they need to get to the CON vote. I think that that's where we're going to end up being, is looking at whether the body believes there's a real or perceived conflict. So the motion's on the table. We may as well do it now quickly.
Point of order, I believe a motion to table supersedes the motion that's on the floor, so I believe there was a motion to table.
No, the motion to table actually would require a vote. And
Yes,
to
but
quote
you
the
can
good
make that
Dexter-
motion with your motion being
Well, but it wasn't seconded.
I will second the motion to table when the time comes.
Fair enough.
Okay, let's take a vote on the motion to table. All in favor of tabling the motion, raise your hand. All opposed to tabling the motion? Same sign. Any abstentions? All right, so the motion to table carries. That motion is tabled until we pull it down from the table. Can we proceed with the
So we still have the matter of, I believe we were on Scarsdale, I don't remember. The Scarsdale CON appeal. And the seconded motion is to uphold the February 2023 determination of the Westchester Regional Emergency Medical Services Council, which approved the Scarsdale Volunteer Ambulance Corps' application for the expansion of ambulance service primary operating area.
Mr. Chair, I make a motion to table this.
Second.
The table is tabled until it's pulled down from the table.
I believe you have to define until when. That, I was caught in that not too long. Table it, yes, but when would it come back to this body for another vote?
It can be tabled, just tabled, and then it stays on the table until it's taken down off the table, unless you table it until a certain time.
Until we resolve, sorry, Al-Kim, until we resolve the first tabled motion, which is, right, that's in order.
Not necessarily, but practically.
Yeah, practically.
Can I call the question?
Say that again? All right, call the question. All in favor of calling the question, raise your hand. Any opposed? Any abstentions? So we'll call the question. All in favor of tabling the motion on this appeal, raise your hand. Oh, wait, hold on. This is a statutory thing, so we have to do a roll call vote. So those in favor of tabling this.
Steve Katie,
Steve Katie, yes.
Scott Clark,
Scott Clark, yes.
Dr. Krupe,
Rokupi, yes.
Mark Devers,
Mark Devers, yes.
Don Duvall,
Duval, yes.
Mickey Forness,
Mickey Forness, yes.
Jason Haig,
Jason Haig, yes.
Teresa Hamilton,
Teresa Hamilton, yes.
Don Hudson,
Hudson, yes.
Dr. Isaacs,
Doug Isaacs, yes.
Al Kim,
Al-Kim, yes.
Steve Kroll,
Steve Kroll, yes.
Andrew Knoll,
Andrew Knoll, yes.
Al Lewis,
I will vote to table, but I'm very disappointed that we couldn't get through this so that there's a decision for these two municipalities.
William Masterton,
Yes, Masterson, yes.
Michael McAvoy,
McAvoy, yes.
Mark Philippi,
Philippi, yes.
Marianne Portoro,
Marion Petoro, yes.
Dr. Raybridge,
Raybridge, yes.
Dr. Redlener had to leave. David Simmons,
David Simmons, yes.
Carla Simpson,
Carla Simpson, yes.
Christopher Smith,
Christopher Smith, yes.
Chad Smith,
Chad Smith, yes.
and David Violante.
Violante, yes.
Motion passes to table this motion.
All right, until such time as it's taken off the table. You have one more appeal.
I do. I have Austining Volunteer Ambulance Corps, an appeal of the September 15th, 2022 application of Austining Volunteer Ambulance Corps. The second motion is to uphold the February 2023 determination of the Westchester Regional Emergency Medical Services Council, which approved the Austining Volunteer Ambulance Corps' application for the expansion of ambulance service primary operating territory.
Mr. Chair, I move to table this also.
Seconded by Mickey Forness. All in favor of tabling this motion for the appeal? Roll call vote, yeah.
Steve Katie,
Steve Katie, yes.
Scott Clark,
Yes.
Dr. Krupe,
Krupe, yes.
Mark Devers,
Yes.
Don Duvall, Michelle Fornes,
Mickey Fornes, yes.
Jason Haig,
Jason Haig, yes.
Terry Hamilton,
Teresa Hamilton, yes.
Don Hudson,
Hudson, yes.
Dr. Isaacs,
Doug Isaacs, yes.
Alfred Kim,
Al Kim, yes.
Steve Kroll,
Steve Kroll, yes.
Andrew Knoll,
Andrew Knoll, yes.
Al Lewis,
Yes, the point of order, do we have a quorum right now?
We do?
All the people that's left, you still have a quorum?
the only person that's left was Dr. Redlener. Al Lewis, your vote?
I vote yes.
Okay. William Masterton,
Masterton, yes.
Michael McAvoy,
McAvoy, yes.
Mark Philippi,
Philippi, yes.
Marianne Portoro,
Mary Portoro, yes.
Dr. Raybridge,
Raybridge, yes.
David Simmons,
David Simmons, yes.
Carla Simpson,
Carla Simpson, yes.
Christopher Smith,
Smith, yes.
Chad Smith,
Chad Smith, yes.
David Violante,
Violante, yes.
and I'm going back to Don Duvall, who has re-entered the room.
Duval, yes.
Motion passes to table this motion.
All right, until taken off the table. Thank you. Does systems have any other trouble?
In the interest of time, in the near future, and I'll put it back up on Boardable, is the link to the definition of need questionnaire. That is the one thing that we are kind of really struggling with, and with that, I am done with my report.
Thank you. The SEMSCO members who are here have decided to seek a more extensive legal opinion about conflicts, and that will assist us in pulling this off the table at the next meeting. We have our counsel here representing us and representing the state, and we'll follow up with them and with others to determine what actually should define the question that we were pondering over the last hour and a half or so. Any old or new business? If not?
Motion to adjourn?
Yeah.
Second.
Thank you. Thank you all for your service. Have good holidays, and staff will issue sleeping bags at the door.